I'm often asked, what are the risks of having varicose veins but not treating them? Well, the great majority of patients with varicose veins are going to experience symptoms and then, of course, the appearance of the legs. And in the great majority of these patients, those just tend to slowly progress. And again, that's because the gravity continually affecting the valves, blood backing down the veins, and the veins being distensible. And so they have a progression of symptoms and of appearance. In a minority of patients, and by that I mean approximately 10% of the patients that we see in our office at East Tennessee Vein Clinic, they'll present with complications. And the most common are intractable swelling, swelling that just persists, much more severe swelling, skin discoloration, where the skin is actually starting to redden, and then as the continued inflammation of the veins affects the legs, there becomes a darkening of the legs, and this is typically over the lower legs because blood is draining back down toward the ankles. In some patients, this inflammation becomes so severe they actually get skin breakdown and skin ulcers, which tend to be open wounds and scabs, which are very slow in healing and which recur frequently. Other complications can include bleeding from the veins, where patients, the common scenario is somebody will have taken a shower and be toweling off, or in the shower still, when all of a sudden they'll begin to gush blood out of these veins. And they can bleed quite heavily, and that's because the blood is trying to empty out of all these varicose veins through very small pinholes, and it'll actually appear as if it's spurting like an artery. But hemorrhage is another complication that's fairly common. And clotting, phlebitis or clotting. Varicose veins, if you think about that the blood within the veins isn't circulating normally, that is to say it's moving up and then falling down again, churning in the vein as opposed to continuously moving up the leg. When blood sits still, it's more prone to clot. And so phlebitis is symptoms of a painful hardening over the veins, where the veins get red and hard and very uncomfortable. And this can, in some cases, progress to even the larger, deeper veins, where it's actually a risk to the limb and even to life, a pulmonary embolus. But again, that's in a minority of patients. That's not the reason that we treat most patients. When patients have these symptoms, any of these, they should be treated. In most patients, though, their symptoms simply will be a progression of pain and the appearance, and so they treat them to make them feel better, to make them look better, and to keep them from slowly getting worse.